Hi, my name's Kia. I'm a second-year student nurse at Medicine Hat College, and I'm going to be taking your vital signs today. So what that means is I'm going to be taking your pulse, your blood pressure, your temperature, your respiratory rate, and your oxygen saturation. So have you ever had your vital signs taken before?
No.
Okay, and do you have any history of hypertension, diabetes, or other illnesses?
No.
Okay, and do you have a family history of hypertension, diabetes, or any other illnesses?
No.
Okay. Are you on any medications right now?
No.
Okay, and have you smoked or consumed caffeine in the last hour?
No.
And have you exercised in the last half hour?
No.
Okay. Okay, so now I will perform hand hygiene. Okay, we're going to start today by taking your blood pressure. So I'm just going to measure this cuff on you. So it covers half her arm. So it might be a little bit big, but it's what I've got. So we're going to use it today. Okay, so first thing I'm going to put it, well, I'm going to find her pulse before I put it on. Maybe. Okay, there it is. Okay, so now I'm going to slide this on her arm and line up this right arm where I just measured her pulse. Get it as tight as I can here. So it doesn't get quite tight enough because it's a little bit loose, but, or it's a little bit too big, but I think it should be okay. And I'm just going to start by determining her palpatory blood pressure. So what I'm going to do is find her pulse again. And I'm going to make sure my valve is closed on here and hold it at eye level. And I'm going to inflate it until I can't feel her pulse anymore. Okay. It stopped around 130. So I'm just gonna, when I do it, I'm gonna inflate it to 160. Okay, just leave that there for a sec. And now I'm gonna make sure that my bell is working, and it is. And I'm gonna put it over her brachial pulse. Here, and going to make sure that my valve is closed again. And I'm going to, well, I would have waited 1 to 2 minutes if she was a real patient between the palpatory and the real one, but I'm not going to do that because I just want to do everything at the same time here. So, okay. Okay, and I'm going to slowly release it. Okay. So I released the air all the way, and now her blood pressure was 119/77, so that is right within the normal range of 120/80. So now I'm gonna take this off of her. Okay, and the next thing I'm gonna do is her radial pulse. So I'm just gonna make sure she's got her arm nice and comfortable on the table. And I got my watch ready to go. So now I'm just gonna draw a line down from her thumb to her radial groove, and I'm gonna find her pulse. And then I'm gonna count 1 minute of her pulse here. Okay, so it's been 1 minute. And if she were a real client, I would just keep my hand here and start doing respiratory rates, but I'll just explain first. So her radial pulse was 55 beats per minute, which is a little bit lower than the normal range of 60 to 100, but she's a very active person, so it's not unusual for her resting heart rate to be a little bit low. And her pulse is nice and steady as well. So now, yeah, I would have kept going and just measured her respiratory rate, but I'm just gonna do that for another minute now here instead. Okay, so it's been 1 minute and her respiratory rate was 11. So that's in the normal range of 10 to 20 breaths per minute. So next I would take her temperature. I don't have a tympanic thermometer, but what I would do is take her ear and pull the pinna up and back, and then I would put the thermometer in. I would put a cover on it, one of those reusable covers for sanitation, and then put it in her ear, and then take her temperature, and hopefully it would be within the normal range, which is 35 to 38 degrees. And then the last thing that I would do is take her oxygen saturation. So we also don't have that machine, but I would take the I would take the clip thingy and make sure that she doesn't have fake nails and she's not wearing any nail polish. Take the clip, clip it on her finger, and then wait on monitor for the number to stabilize, and then hopefully it's within the normal range of 90 to 100. Yeah, so then I would do hand hygiene again because I'm done touching her, and then that's it for her vital signs. And then I will also fill out this sheet with her numbers on it, which I'll attach in the email with my video.